Hello dear students, welcome to Dr. Acremonic classes. In today's lecture, let us try to learn about cephalosporins. Cephalosporins are very similar to penicillins, and these are betalactam antibiotics which are obtained from Cephalosporium acremonium fungus. Okay, whereas penicillins were discovered from Penicillinum molds. Anyways, these both antibiotics are betalactam antibiotics, and cephalosporins are very similar to penicillins in pharmacokinetics and mechanism of action. The mechanism is very similar to penicillins. In the previous class, I have discussed in detail the mechanism of action of penicillins, how these penicillins will act by degrading the cell membranes, by inhibiting the synthesis of cell walls in the bacteria, and how they show bactericidal activity. So I have discussed that in detail in my penicillins class. So please go and watch my penicillins video so that it will be very easy for you to understand cephalosporins also. Anyways, in this lecture I will not explain in detail the mechanism of cephalosporins. Yeah, so cephalosporins are mostly given through oral form, and they are also given in IV form, and most of them are usually given in IV form. And in the cephalosporins we should remember a drug called ceftriaxone, which is very commonly used drug, and it has many unique properties. Anyways, we'll be seeing. So let us see some pharmacokinetics about cephalosporins. Some of the cephalosporins are available as oral form, and some are available in IV form, parental form. Okay, so oral forms and IV forms, they are mostly absorbed from oral drugs are absorbed from GI tract, and IV are distributed all over the body. And some drugs are metabolized, whereas some are not metabolized and excreted directly through urine. Some will undergo glomerular filtration, and some is excreted through tubular secretions, same like penicillins. Most of them are secreted by tubular secretions and excreted through urine like penicillins. And remember, cephalosporins and penicillins are having one important interaction with probenicid. When probenicid is given with penicillins and cephalosporins, this probenicid competes with the tubular secretion, and it increases or enhances the antimicrobial activity of penicillins and cephalosporins. Okay, this is important thing. Few will be metabolized in the liver, and few will directly excrete in unchanged form. So many cephalosporins are very much distributed in all over the tissues. They are distributed in cerebrospinal fluid, and some crosses BBB and some doesn't cross. So this is the pharmacokinetics of cephalosporins. Now let us see. Cephalosporins are categorized into 5 different generations. So sorry, 4 generations. So the first generation of cephalosporins, this is very important in the examination, so you have to remember these drugs. So in the first generation cephalosporins, we have cefalexin, which is given through oral form, and some of them we have cephadroxil. Even cephadroxil is available in oral form. We have cefazolin. Cefazolin is available in IM and IV form, and remember, cefazolin is having higher duration of action. Because of that, most commonly cefazolin is given as a prophylactic drug therapy in the surgeries. So, okay, cefazolin is very important. And next we have cephradime. So cephradime is available in oral, IM and IV form. And finally we have cephalothin. Cephalothin is very important drug. Cephalothin is it should not be indicated with aminoglycosides. If this cephalothin is given with aminoglycosides, it shows nephrotoxic activity. So this is a very nephrotoxic drug. So this drug is usually not given with aminoglycosides. Even first generation drugs are not commonly used because they have some drawbacks. Anyways, we'll be seeing. So these are some first generation cephalosporins, and next we'll go with second generation cephalosporins. In the second generation cephalosporins, we have cefaclor, which is oral form, and we have cefuroxime. Cefuroxime axityl. Cefuroxime axityl is a prodrug actually. So cefuroxime axityl is available in oral form, whereas only cefuroxime is available in IM and IV form. So cefuroxime exitil, which is when it is given through oral route, it undergoes first pass metabolism and it is activated. Prodrug is activated in the liver and it will have its activity. And we have cefoxitin. Cefoxitin is another second generation cephalosporin available in IM and IV form. We have cefotetan and cefprozil. So these are some of the examples in second generation cephalosporin. Now let's discuss the third generation cephalosporin. Third generation cephalosporins are very important drugs which are commonly used in the hospitals, and we have to concentrate especially on these classifications. So the first drug from this third generation cephalosporin is cefixime. Cefixime is available in oral form. It is not available as a parenteral form. Okay, so cefixime is very important. And we have cefodoxime proxetil. Okay, cefodoxime proxetil, even this is same like cefuroxime exitil, and it is a prodrug which is usually formulated in oral form. And we have ceftriaxone. Ceftriaxone is very important. Ceftriaxone is commonly, it is formulated as IV. It is given through IV infusion only. IV bolus also we can give. So ceftriaxone is formulated as monocef. It has many formulations, and this is a drug of choice in typhoid. Remember, so third generation cephalosporin, it is not only drug of choice in typhoid, it can be given in almost all nosocomial infections, in pneumonia, in upper and lower respiratory tract infections, and many other soft tissue infections. So ceftriaxone is very important. And we have cefodoxime. Cefodoxime is another one, and it undergoes heavy, actually it undergoes hepatic metabolism. So it is not excreted in unchanged form. It undergoes hepatic metabolism, and metabolic end products are excreted through kidneys. And we have cefuroxime. And remember, cefuroxime is the only third generation cephalosporin which is excreted through bile. So this is another unique property of third generation cephalosporins. These are unique points that are most commonly expected in some examinations. So we have to remember these things. And we have ceftriaxone, which is formulated in IM and IV form. And we have cefdinir and ceftibuten. So these are some of the examples in third generation cephalosporins. And in these third generation cephalosporins, just remember cefodoxime, which is formulated as oral form, and cefixime is most commonly given, and ceftriaxone is very commonly given drug. Even cefodoxime is also commonly used in the hospitals. And in the fourth generation, just remember P, cefepime and cefpirome. Cefepime and cefpirome are the two drugs from the fourth generation cephalosporin. These are some of the examples. Now let us see some important characters of these drugs. So remembering the drugs is very important in cephalosporins. Now let us see the bacterial spectrum of cephalosporins. So I will not tell the individual drug, I will just go with the generations. So in the first generation cephalosporins, they are very effective on gram-positive microorganisms. First generation gram-positive, and even second generation are very effective on gram-positive organisms. And third generation and fourth generation are slightly they are active on gram-positive organisms. Remember, first generation and second generation are very active on gram-positive organisms, and third and fourth are very low. And remember, gram-negative organisms are very less. They are first generation and second generation are not effective on gram-negative organisms. They are very less effective on gram-negative organisms, the first and second generations, and third and fourth generations are very effective on gram-negative organisms. So this is the unique property of bacterial spectrum of cephalosporins of these generations. Okay, first and second generations are effective on gram-positive, and third and fourth generations are very effective on gram-negative organisms. So that is about spectrum. And while talking about the aerobic bacteria, first generation, second generation, third generation are very effective on aerobic bacteria, whereas fourth generation is not effective on aerobic bacteria. And while talking about Pseudomonas infections, first generation, second generation are not effective on Pseudomonas infections, whereas third and fourth generation are very effective on Pseudomonas infections. And while talking about Salmonella infection, third generation is the drug of choice. Remember, Salmonella typhi is the bacteria which causes typhoid disease. So in typhoid disease, you should not use any other cephalosporins, only third generation cephalosporin. And in third generation, we can use any of the drug, but most commonly we use ceftriaxone as drug of choice in typhoid. Typhoid is treated with ceftriaxone, and 1 gram IV BD 3 days is given for the treatment of typhoid, and this is very effective treatment when compared with other drugs. No other antimicrobial agent is effective for typhoid. So in typhoid, third generation cephalosporin is the drug of choice. Okay. And next one is betalactamase. Yeah, penicillins and cephalosporins are betalactam antibiotics, and this beta-lactam ring is degraded by betalactamase enzyme which is present in the bacteria. Okay, and in the previous class I have discussed in the penicillins. Just you go and watch there, you will find more information about beta-lactamase inhibitors. So most of the cephalosporins are very resistant to beta-lactamase enzymes. Okay, so first generation is resistant, second generation few are resistant and few are not, and third and fourth generations are very much resistant to beta-lactamase enzymes. Anyways, we don't use most of the times we don't use beta-lactamase inhibitors, but in some cases we use them. Okay, and so listen guys, second generation cephalosporins will cross blood-brain barrier, whereas first, third and fourth will not cross blood-brain barrier. So second generation drugs are commonly given in meningitis conditions and infections related to central nervous system. And yeah, uses. So in first generation cephalosporins we don't have many uses, but remember guys, in surgical prophylaxis we commonly use first generation cephalosporins, and in surgical prophylaxis we use cefazolin. Cefazolin is a drug of choice in surgical prophylaxis, and because of its high duration of action, so we use this drug. So other than that, we can use in the oral infections and in other surgery infections we can prescribe first generation cephalosporins. And in second generation we have some dental uses. So when dental procedure is performed, we use second generation cephalosporins. And in respiratory tract infections, abdominal and pelvic infections, we use second generation cephalosporins. Most of the time we don't use second generation cephalosporins. And third generation cephalosporins will have many uses because these are very important drugs when compared with other generations in cephalosporins. Okay, so it is used in pyelonephritic conditions. So usually in the urinary tract infections, actually we have lower urinary tract infections and upper urinary tract infections. We call complicated and uncomplicated. And in complicated urinary tract infections, we use cephalosporins as a drug of choice, and third generation cephalosporins are drug of choice in the pyelonephritis, complicated urinary tract infections. And if you want to learn something about urinary tract infections, please go and watch in my channel. You will find about urinary tract infections also. And yeah, third generation cephalosporins are commonly used in community acquired pneumonia. As I told you previously, they are drug of choice in pneumonia. Pneumonia means lower respiratory tract infections, and it is drug of choice in typhoid, as we have discussed. It is used in gonorrhea, meningitis, septicemia, and nosocomial infections. See, when a patient is admitted in the hospital, remember guys, most of the patients will start with cephalosporin. So cephalosporins are drug of choice in treating nosocomial infections. So in third generation cephalosporins, any one of the drug is commonly indicated for nosocomial infection. So these are the different uses of third generation cephalosporins among these. And fourth generation will have the same, almost the same uses, but we don't use fourth generation cephalosporins because of their few drawbacks, like their duration of action is very low and they are very less indicated for gram positive bacteria. So they are not commonly, they don't have gram positive spectrum of activity. Because of that, we don't use fourth generation cephalosporin. And While talking about the spectrum of activity and covering the aerobic and anaerobic bacteria and other bacteria, third generation cephalosporins fulfills all the categories. That is the reason we commonly indicate third generation cephalosporins. So these are important points about cephalosporins, and there are very few ADRs which are seen with cephalosporins. And the first one, cephalosporins are same like penicillins, so they will have hypersensitive reactions. Most of them don't have, but few may cause hypersensitive reaction. And gastric related disorder is common with almost all the antibiotics. So diarrhea, nausea, vomiting is commonly seen with use of cephalosporin. And pain at the site of injection, when especially when they are given through IM, they cause a severe pain. So that is one ADR. And as we discussed, some of the drugs in the cephalosporins will act like nephrotoxic. They have nephrotoxic property, and among them we have cephalothin. Cephalothin is one of the drug which has high nephrotoxic property, and it should be strictly contraindicated with aminoglycosides, where aminoglycosides are very nephrotoxic drugs. And if you want to learn about aminoglycosides, please watch in my channel. You will find about aminoglycosides also. And finally, they causes bleeding. So sometimes cephalosporins may cause bleeding, and bleeding patients may be treated with vitamin K injections. Okay. And patients with alcohol, they should be cautiously treated with cephalosporins, because some of the patients with alcoholism, they may cause disulfiram like reactions. So alcohol consumption should be stopped while taking cephalosporins. So this is about a brief explanation about cephalosporin. And if you learned something from this video, please don't forget to subscribe our channel and like it and share with your friends. Thank you for watching.